So an update on inclisiran, evidence of its use so far, and including in the UK. So Orion 4, as Louise has described, is a large trial which is seeking to find out whether treatment with inclisiran reduces these complications in individuals who already have a history of circulatory disease. However, there were earlier trials of the same drug, and I've tried to summarize those earlier studies on this slide. You'll see they also have the name of Orion. So there's the Orion 9, 10, and 11 studies. And there are actually also some other studies which were done and other smaller studies which are ongoing in different groups of people. But these key studies were run in different parts of the world. The University of Oxford was not involved in the running of these. These were run by the company that owned the drug at that time. They were focused on people who already had circulatory disease and high cholesterol, and in some cases also in people who had genetic problems with high cholesterol, such as familial hypercholesterolemia. You'll see these studies were somewhat smaller than Orion 4, but still pretty big. So overall, about 3,500 people. They were relatively short at about 1.5 years. And the purpose of these studies was to have a proper look at what this intervention, this medicine would do to people's bad cholesterol, which I'll show you on the next slide, and also to get a good idea of its safety profile. But they were not able to detect properly whether this medication would reduce the risk of things like heart attacks and strokes. And that's why Orion 4 is so important. So the next slide really shows what is the effect of this drug on your LDL. Commonly, we refer to it as your bad cholesterol. And of those 3 studies I showed you on the previous slide, this just picks one of them, which is the Orion 10 trial. And what you see on this graph is along the horizontal line at the bottom is the number of days taking part in the study. And in the y-axis going up and down is the amount that somebody's cholesterol changed overall. And this groups together all the patients from that study. And what you see in the gray line is that probably as you anticipate, people who received the placebo injections, which was at baseline at around 3 months and around 9 months and 15 months, had pretty little change in their cholesterol. However, the people who received the inclisiran injections at the same time points overall had, give or take, a 50% reduction or halving in their LDL cholesterol, just as Louise mentioned. We could have showed you information from those other 2 studies as well, but it pretty much shows the same thing. So, to really summarize what we know from these previous studies, all of which are published and in the public domain, one thing to say is that the safety of inclisiran in these studies did appear to be very good. There was no clear difference between the drug and the placebo, with one exception, which was a small number of people, typically around 2% in some studies, less than 5% in another, had mild injection site reaction. So around the place where the injection was given, a small number of people did get some redness. However, nothing else was seen, and there was no adverse changes seen in any kind of laboratory tests that were done either. And as Louise and I've already remarked, this halving in bad cholesterol, which is pretty much what you might expect to see on the top dose of the most effective statin. So that's interesting background. What about what's happening in the UK? So I'll show you a little bit of information about NICE guidelines. These are guidelines which are produced and typically are adopted in both England and Wales. But some guidance did come out in 2021 in October. And what was recommended at that point was that inclisiran could potentially be offered to people with circulatory disease, such as previous heart attack, as long as they had a bad cholesterol level of at least 2.6 millimoles per liter. This is the kind of thing that you would all have measured once in a while, as long as they were taking as much background medicine, in particular statins, as possible. So that's at least in theory what might have happened from October 2021 based on these NICE guidelines. I will show you what's actually happened in a second, and we can explain why. Moving on from England and Wales to Scotland. Scotland has a different body there called the Scottish Medicines Consortium. They have slightly different recommendations about inclisiran use in the NHS at the moment, and they are rather more restrictive. So at the moment in Scotland, the rules are that one could potentially be offered this medicine if you have circulatory disease, but you also need to have a bad cholesterol level of at least 4.0 or higher, so not the 2.6 in England and Wales, so 4.0 is quite a bit higher, or If you have more severe disease or you have genetic problems with cholesterol as well, then potentially a slightly lower threshold is used of 3.5 millimoles per litre. Another difference in the guidance at the moment between Scotland and England and Wales is that this medicine, inclisiran, is only offered through specialist care, such as the kind of lipid clinics that Louise and I and others do. However, that's background. The question is what's really happening in the NHS. And I think this slide, which I'll talk through in a second, emphasizes why the Orion 4 trial is so important. You can see that the drug started to be used in late 2021. And this is the numbers of prescriptions that are issued from GP practices across England and Wales every month. So what you see is a steady increase. Maybe it's kind of flattened off a little bit in the last few months of 2024. But overall, you're still only looking at about 3,000 patients. This is across the whole of England and Wales. And the number of people who are, in theory, eligible is many times higher than that. And the reality is that there is some caution, and GPs and other bodies are looking for the evidence from the Orion 4 trial, really, to make them to give them the confidence that this drug is indeed not just lowering cholesterol, but is in fact reducing heart attacks, strokes, and other complications. That's the missing information that everybody is waiting for. So I guess the point is, in theory, the drug could be offered to some. We know that in many parts of the UK, it's used very sparingly at the moment, and the Orion 4 trial will hopefully, should it show positive results, be the key to unlocking much wider use of this very promising medication. So in summary, I'll present this slide and then hand back to Louise. The drug does certainly reduce LDL or bad cholesterol by about half if one's taking it. Studies so far do suggest a very good safety profile. There's just the occasional injection site reaction that has occurred. However, even though recommendations suggest that it could be more widely used, for the moment, the drug is used rather sparingly in the NHS, and that is largely because people are waiting for the results of the Orion 4 trial to emerge. And beyond all of this, beyond the Orion 4 trial even, it's very important to stress, as always, that you continue your other background therapies. There's excellent evidence to support the use of statins to lower cholesterol, blood pressure lowering medicines, and aspirin and other blood thinners, which we know are very effective at reducing the risk that people with circulatory problems go on to suffer a further event. And what we're trying to do in the Orion 4 trial is to say we can take good therapy and we can make it even better.